my primary source of preparation is Marrow in my recent days, and I use question banks and the Marrow videos also in a in a good way that I can use my time as well. After doing Marrow question bank, I understand the importance of MCQs, because you need to do MCQs. Without MCQs you cannot apply your knowledge, how what you are reading, but you cannot apply your knowledge, because when I see pneumoconiosis, there is silicosis or asbestosis, but when you apply it, what the upper zone of the lung is involved in the silicosis and the lower zone is involved in asbestosis. You need to differentiate between two, because the examiner always giving that two options to confuse you. So you need to apply and what important parts of the notes. You do not read each and every point of the notes. You need to read the salient points. So that points are, what are that points you understand when you doing MCQs, and what questions are asked from that. Sir, you were the most inspired faculty for me, and after that the Rohan Khandelwal sir in surgery, and the Sakshi ma'am in the gynae ops, and also I see every videos of anatomy Raviraj sir. That is also her teaching way is also inspire me as well, and also Ila Jain ma'am pathology notes are so precise, and the tables are very good for and she giving in the at the time of teaching. That is also very good for pathology. After completing my one revision, I seeing the videos, and Marrow videos are excellent. I mainly see the revision videos, and also I see some topics which I not read well, the main videos, and the review videos. I can say it is excellent, because the whole syllabus is completed in 6 to 7 hours, and main each and every points are touched in that video. I mainly used for the previous my exam days, and that small time, I view each and every point, and that is very much important, because sometimes overlapping is present, and I become so much confused, and during this time there is so much postponement. So stress level is also increased, and we have some anxiety, nervousness, and that moment we do not read thoroughly our notes. So at that time, if the videos are present, we can see the small important topics at that moment.
Hi everyone, I'm Dr. Abbas Ali, your orthopedics faculty with Marrow, and today I have an amazing story for all of you watching this rank booster session. I have Dr. Tamoghna from Bankura Medical College, which is at the peripheries of the West Bengal, who has secured a rank of 244. Now, this is an amazing rank in itself, but the point I'm trying to make here is that how he got to this rank, because the same student got a rank of 43,000 last year. So he jumped from 43,000 to 244, and here he is today to share us his journey, and hopefully you will extract some important tips and lessons from his journey so that you can use it in your own. Hi, Dr. Tamoghna, how are you?
Sir, I am good. Sir, how are you?
I am good. Thank you very much. Thank you for asking. It's the first time someone in the audience has asked how I feel, and I feel ecstatic talking to you. So, Tamoghna, please share us your journey of 43,000 to 244. But before you begin, I just want to tell all the viewers here, he's the first doctor in his family of all the engineers, and he wants to become a neurologist in the future. And considering and looking at his rank, it doesn't look like a distant dream anymore, and he can do that. So Tamoghna, tell us what was your reaction after 43,000 last year? Were you expecting that? Because as I've been talking to you, you have told me that you are a consistent student studying decently in MBBS. How did you get 43,000, and did that break your heart?
Sir, I do not get so much time during my intensive days due to lots of pressure in the wards, because I am coming from the peripheral medical college. There is lack of faculties, so we interns, we need to work so much, so we do not get so much time to study. But I give my exam after internship to see what type of questions are coming in the exams. So but after giving the exam, I understand that it is a possible, I mean, it is not impossible. The questions are not so hard in the NEET PG. I do not I know that I do not giving exam with my full potential. I know that, so I do not expect a decent rank after giving the exam, but I understand that I can do well when I read my full course or giving my after
So
giving my full.
what was your primary source of preparation, Tamoghna?
So my primary source of preparation is Marrow in my recent days, and I use question banks and the Marrow videos also in a in a good way that I can use my time as well.
So how see, as we gather, your internship attempt obviously was not so good. You got 43,000, but then you improved it. Why couldn't you get a better score in your internship? What was the what was the problem?
Sir, my problem is that I do not study well at the time of internship, and also I do not doing MCQs at the time of internship. I mean, after doing Marrow question bank, I understand the importance of MCQs, because you need to do MCQs. Without MCQs, you cannot apply your knowledge. How what you are reading, but you cannot apply your knowledge, because but when I see pneumoconiosis, there is silicosis or asbestosis. But when you apply it, what the upper zone of the lung is involved in the silicosis and the lower zone is involved in asbestosis. You need to differentiate between two, because the examiner always giving that two options to confuse you. So you need to apply and what important parts of the notes. You do not read each and every point of the notes. You need to read the salient points. So that points are, what are that points you understand when you doing MCQs, and what questions are asked from that. So
So
MCQs are
in other
very.
words, what you're trying to say is compared to 43,000 and 244, the biggest difference that you noticed in your preparation was you did not do or practice a lot of MCQs, which you did for the rank of 244.
Yes, yes, yes.
So,
And the grand test, and the grand test. I do not give any test during the internship. But grand test is very important, because your time management is also so much important.
so you
Because
missed
if
out on question bank, you missed out on grand test. So these,
grand
what else did you miss out on that you regret not doing well in internship?
I do not do grand test or MCQs, and I only read some points. I do not also read so much at the time of
Mhm.
internship, because
So
I
obviously,
only.
you coming from a government medical college, you must have been very busy during the internship, right?
Yes, yes, yes.
I think that is the real reason here. You being extremely busy with your internship and still not getting time to study. But after the internship, you had ample time. You started with a lot of questions, practicing the questions, and you must have watched a lot of videos. If I may ask you, who was your favorite faculty among among all of us? I know all the
Sir,
teachers are amazing in
sir,
Marrow, but
sir,
which faculty
sir,
would you say that you like the most?
Sir, you were the most inspired faculty for me, and after that, the Rohan Khandelwal sir in surgery, and the Sakshi ma'am in the gynae ops, and also I see every videos of anatomy Raviraj sir. That is also her teaching ways also inspire me as well, and also Ila Jain ma'am pathology notes are so precise, and the tables are very good for who, and she giving in the at the time of teaching. That
Excellent.
is also very good for pathology.
Excellent, excellent. So, what was your usual day like? How would you say your day would go as you were preparing after internship?
Sir, at morning I like to study the clinical subjects. At morning, I usually study during my first 5 to 6 months, 12 hours a day. And it happened because I think during internship I do not study well. So after internship, when I study, I have very eagerness to study. Each and every part of medicine, I am very much happy after knowing that. I'm so much enthusiastic to study that. So 12 hours, when 12 hours passed, I do not know. Sometimes I'm eager to study more, but I do not do that.
You do
So
not have time enough to satisfy your eagerness to study. That is outstanding. That is
Mhm.
amazing.
it's
So you're the
it's
first
happened
person I'm speaking to who found that you wanted to read more, but you didn't have time. That's wonderful. Now, how would
because
you divide your day? How would you divide your day when you would sit down to study?
sir, at the morning 6 hours I study at the morning from 8 a.m. to 2 a.m. and in middle I take one break. And that 6 hours I read mainly clinical subjects, and after that 3 hours I do MCQs. I do MCQs, and after that next 3 hours I do grand test questions or some pulse. Those are at that time at late of the night I do not like to study more, so at that time I only see the pulse or bookmark questions. I
So you
that
would do MCQs every day, Tamogna?
Yes, yes, sir, I do
So this is a
MCQs every
very
day.
important point that I want all of you to understand and imbibe. MCQs practiced every day, because the real exam is an MCQ exam, and if you practice MCQ on a daily basis, you will be pretty much ready for the exam.
And
Anyways,
sir,
what about the videos? What about the videos? How would you watch the videos, and how would you distribute your time to watch the videos and do the notes?
sir, after completing my one revision, I seeing the videos, and Marrow videos are excellent. I mainly see the revision videos, and also I see some topics which I not read well. The main videos, and the review videos I can say it is excellent because the whole syllabus is completed in 6 to 7 hours, and main each and every points are touched in that video. It is excellent, and MCQ discussion are also good. And that videos are
So
also
there
good.
are MCQ discussion videos and revision videos. Both of them are available, and you use that to quickly revise through the stuff that you are preparing. And you say that it is concise but very precise, isn't it?
Yes, yes, yes.
So what was the output of that revision videos and MCQ discussions? How did that help you?
Sir, I mainly used for the previous my exam days, and that small time I view each and every point, and that is very much important because sometimes overlapping is present, and I become so much confused, and during this time there is so much postponement. So stress level is also increased, and we have some anxiety, nervous. Yes, and that moment we do not read thoroughly our notes. So at that time, if the videos are present, we can see the small important topics at that moment.
So you
So
basically use revision videos and MCQ videos to help you revise, because you are getting tired by reading the notes again and again. So it
yes,
added as like an alternative to revising the notes again and again. Right, wonderful.
yes.
So wonderful use of revision videos and MCQ videos. And what about the pearls, Dr. Tamogna?
So pulse are very important because each and every management in the clinical subject nowadays the management questions are very much asked in the orthopedics or the surgery. These are very much important portion. So the management questions or the classifications, the important charts in medicine, the classification in asthma or the management. So each and every part is so much thoroughly explained in the Pearl. And if you revise Pearl well, the bookmarked Pearls, you can revise the subject. And the question bank, the Marrow question bank is so good because if you do the question bank, you can revise the whole subject because each and every chapter in the community medicine, each and every chapter, the environment chapter is there are 9 modules. So if you do not like to read environment, then you can do the question bank and question bank and Pearl. This is a great combination. You can if you do
Right. So
that.
question bank is basically, that's what we keep telling everybody, is a learning tool as well as a revision tool as well as a practice tool. So the information given in the question bank is so beautifully arranged that even if you don't know anything about the topic, if you pick it up, you'll understand step by step what you need to know in order to complete that topic. Now, I want to ask you about grant test, Dr. Tamogna. How many grant tests did you give, and what was your usual score?
I gave all the grant test available in the Marrow from my 2020 when I subscribed the plan at the January 2020. Total I gave 30 to 35 grant test. I can say that
Wow.
due to postponement there are so much grand test, and and it is great. Grand tests are really amazing.
Why would you say that grand tests are good? Why would you say that?
Sir, because when I giving the grand test at the first, because in the computer screen, and it is giving same examination feeling, because the same type of tabulations are present, same type of bookmark during the real exam, so it gives a feel that you are giving the real exam. And after that when the marks and rank are came after sometimes, it gives a joy that I get some rank or anything. And the wrong answers, when you revise that, the explanations are also good in the grand test,
If you
so it
understand
is.
this, the explanation in the MCQs of the grand test are not only limited to the correct answer, they will in fact tell you why other options are wrong. Did you notice that?
Yes. Yes, sir. It is so much important to understand that, because the questions are always not came same, but it is the topic important from where the question is asked. I always revise that topic also, from where I doing my questions wrong. I also revise that topic, because topic is so much important, because that question is not asked in the real exam, but that topic is
Dr.
asked.
Tamoghna, I want to ask you this one very important question. The language that is used in the question bank, or the language that is used by the teachers to teach you in the videos, how do you feel that language was? Was it simple for you to understand, or was it very complicated?
Yes, sir. It is very simple language. It is very simple, because when you are a medical graduate from our country is a diverse country, because there are so much type of language. But when you are a medico, you know the basic language, basic sense in English. It is always present, and it is good. It is very simple. I have no objection about
You
it.
never felt any kind of difficulty understanding or comprehending the question
No,
bank
sir.
or the teachers on Marrow?
No, sir. No, sir. I have
That is
no
lovely. That
objection.
is lovely, because some of the students, they do tell sometimes that they find a little bit of difficulty understanding the language of the question bank. But now, thanks to you, now it's reassuring that there is no challenge that way. Now,
I think
yeah, please.
sir, it is practice. When you finding some difficulty, you need to practice it again and again. You have to correct your weaker side. It is very much important. Do not object, giving objection to other side,
So
but
you
keep
were saying,
preparing
the question bank, Dr. Tamoghna, the question bank you were saying was very important in helping you. Do you know the part where there is custom modules?
Yes, yes, I
So
know that.
have you
And
used custom modules?
Yes, sir. Yes, sir. I used custom modules. Very much used it, and I use mainly the number type of questions, the common type of questions, and the NEET and AIMS type of question. After completing my one revision, I start doing the customized modules, because it make your weaker side so much strong. When you understand that you are weak at numerical type of questions, or the common type of questions, or the clinical type of questions, you can select that and you can practice that. So it is a good learning tool, I
It's a
would say.
beautiful tool where you want to focus on a particular area of your weakness and improve it and make it strong. Now, Tamoghna, I want to ask you this. What would you teach your juniors, or tell your juniors who want to score a rank something like you have done? So what would be your sincere advice to them?
Sir, I only tell that believe in yourself. You are not a failure. I mean, don't mark yourself as failure, because event one event in your life can fail, but but you are not failure. And keep doing your job, and give priority in your weaker section. Evaluate yourself. It is so much important to evaluate, and then prepare yourself by keep better, keep
No, in
yourself.
terms of preparation, what would your advice be them to them in terms of preparation, using the question
Preparation,
bank, the videos, and revisions?
sir, each and every day you need to do question banks, and give GTs twice in a month, at the first time of your preparation, and then keep increasing the frequency of giving the grand test. and don't fear of giving a grand test, because it is a learning tool. The
Yes,
number
yes.
of the
A lot of
rankers.
students feel apprehensive before giving a grand test. Dr. Tamoghna, I wanted to ask you this. What was your last 10 days to 1 week before the exam like? What were you occupied with?
So last 2 days just before the exam, I do not read so much because I am so much anxious at that time because of the exam, and I only read for 1 hour in a day, and last 2 days, and before day I study well, but just before the exam I am so much anxious about that, because what happened after the exam, that things that came in my mind because I am so much fatigued at that time.
What was your
So
reaction post result, the 244 rank? What did you feel?
the
Because
post
it was
result,
an unreal rank.
the post result, it is really amazing because after giving the exam I do one or two silly mistakes because I completed the whole exam. What you had said that do not overthink in each and every questions. So I mark each and every answers in my first shot, and it is all, it is right. But after completing the exam I have 30 minutes in my hand, and that time I change answers in two of my questions which I am confused of, but at the first time I marked the right answer and I changed that. But yeah, I am so much depressed for that 1 or 2 days, because if that is correct, my rank was 100 more above from
That's
this.
okay. That's okay. I think this is no less than an amazing rank, and it's a wonderful experience. Understanding that you should not have over thought about that question, and that's what we always keep telling the students. Don't overthink. Don't fall for the easy question trap. And it's okay. I mean, all's well that ends well. And 244 is no joke. It's an amazing rank, and your future seems very, very bright considering all the odds. One last question I want to ask you, in terms of the controversial questions, a lot of students feel that there are certain questions that are controversial, and they spend a lot of time discussing and thinking about those questions. What is your advice to them regarding this issue?
Sir, I think do not waste more time for the controversial question because it is it always controversial. It do not change, and some questions are come in the NEET PG also, that are also controversial, and some question are always come, and that do not decide your rank because it is controversial for each and everyone. Sometimes it will correct for someone because of the luck factor, but I think it is not so much affecting your rank, because the almost all questions, 99% questions are from your notes, or that are not controversial. So you can strengthen your that area, and
So
controversial
focus
is
on the
really
99% and don't worry about the 1%. Would
1%.
you
Yeah.
recommend your juniors to use Marrow, Dr. Tanmoga?
Yes, yes. I always recommend them because it is a awesome app, because who planned this app, it is a great, because the images in app, images present in the app, and the videos are so much decent, I can say. The pictures, the picture quality of the video, and the speed also. When I read, it is 2x speed, and now it is 2.5x and 3x is present. When you like to review it in a short time, you can do that when you are adapted with that.
So amazing, amazing. Thank you, Dr. Tamoghna. Thank you for giving your time. And I'm sure the people watching us will find some value and try to take inspiration from your journey of 43,000 to 244 and take the tips that you have shared with us today and use in their own journey. Thank you for joining us. I wish you all the best for your amazing future. And I'm looking forward to seeing you practice as the most popular and the successful neurologist from
Thank
West
you.
Bengal. Thank you very much. Thank you for being here. Bye bye.